Less than a decade ago, the picture of health for the world's poorest was bleak. HIV/AIDS, tuberculosis, and malaria were sweeping across the globe. Devastating families, killing millions, and shattering hope. Sick mothers could not care for their families. Workers in poor health caused businesses to fail. Entire nations were being brought to their knees. The UN Secretary-General called on world leaders to defend health as a human right with a bold historic experiment. The Global Fund to fight AIDS, tuberculosis, and malaria. Between 2002 and 2010, the Global Fund has committed over $19 billion in 144 countries. The fund empowers countries to develop and manage their own plans to tackle these epidemics. Diverse partnerships bring all stakeholders into the fight. Local resources are marshaled to increase access to health care in every community. In Kanzi, Rwanda, a mother and son no longer have to travel a day or more for routine medical care. A neighbor, Febroni Kankira, has become a community health worker through a program funded by the Global Fund. In facilities like these, doctors and nurses finally have the drugs and tools they need to save lives. In just a few years, dramatic improvements have begun in the fight against the world's 3 major killer diseases. 7 million people have been treated for active tuberculosis, and bed nets protect hundreds of millions of African mothers and children from malaria. 2.8 million people have received antiretroviral treatment for HIV, 2.1 million of them in Africa. And thanks to programs which prevent mother-to-child transmission of HIV, hundreds of thousands of children have been born free of the HIV virus. In Indonesia, Evi Noviandari relies on one such program to protect the health of her unborn baby.
Terima kasih banget sih ya buat Global Fund.
Since my husband died after getting HIV, my hope is very simple: to see my children happy and free from disease. I am so grateful to the Global Fund for making this program possible.
Paid for by the Global Fund, the Kabutare District Hospital in Rwanda has a pleasant, airy facility for the treatment of patients with multi-drug-resistant tuberculosis. There, Helene Uwinana, a former nurse, looks forward to returning to her work.
All the while on my way here, I had no hope I would survive. But once you're at this place, the hope comes back. And now I look forward to being discharged and going back to a normal life.
In the hospital's pediatric ward, these children would almost certainly have died from severe malaria. With treatment made available by the Global Fund, they will soon be laughing, playing, and returning to school. In large parts of the developing world, the tide is definitely turning, especially for women and children. 1/3 of Global Fund money goes into training, to building and equipping health centers, and to strengthen capacity to procure drugs and equipment. Broad, powerful, and deep, these successes are beginning to lift the burden on nations' health systems and rippling outward, creating impact far beyond treating the 3 diseases. The Global Fund encourages governments and communities, civil society, and the private sector to join forces and coordinate their efforts.
In this country, we are very well organized in order to look at the level of implementation through field visits, through regular meetings, and interaction with stakeholders.
Thanks to the Ethiopian Interfaith Forum for Development, Dialogue and Action, supported by the Global Fund, faith leaders in Ethiopia are speaking with one voice to erase the stigma of disease which prevents people from being tested and treated.
Stigma and discrimination is very dangerous And we are teaching the people not to ignore our people living with HIV/AIDS. We have to share love and friendship and support them.
We have joint meetings with the Ethiopian Orthodox Church and other civil society organizations. Sharing literature and experiences gives us knowledge, and we educate our followers, us in our mosques and they in their churches.
Industry leaders know that a healthier workforce means a healthier economy, and the cost of doing nothing is far too high. Global Fund-supported programs aim to increase productivity and create more robust economies. At the Dawn of Hope AIDS Recovery Center in Adama, Ethiopia, recovered patients build new clinics, make furniture, tend farms, or raise livestock. They earn a personal income and share the profits with the center.
Today, we are expanding the center, and this new facility also will employ HIV patients and generate income by providing non-HIV medical services to the community. We hope this can be a model for our country and other African countries.
Individuals, families, communities, and entire nations can now picture a better future. Stronger and more sustainable health systems, changing attitudes, healthier communities, strategic partnerships, rising economies, vast improvements in the health of women and children. Proof that investments in the Global Fund are beginning to reap huge dividends.
Improving maternal health.
Reducing the stigma of HIV/AIDS.
Bringing faith and medicine together.
Their progress is fragile and depends on our continued support. We are all connected.
Our clinic is stronger.
Our families are stronger.
We are stronger.
An investment in one life is an investment in all our lives.
We are saving lives, and this is the most important thing you have to look at.
Your investment is working.
We cannot stop now.
With your help, the world is moving closer to a new picture of health.